So hi everybody, just want to welcome everybody here. This is really a great thing, as you can see, a very bipartisan group up here. I just want to say thank you, and we'll be talking about this in a minute, but to all the caucus leaders. Speaker Cutler, who will be here in a few minutes, Leader Benninghoff, I think, will be here, Leader McClinton, who is here. I want to thank you, Leader Ward. Very nice to see you. Leader Costa, and of course many others are here, but I want to especially mention Senator Collette, Representative Kozarowski, Senator Brooks, Senator Brown, Senator Hughes, Representative Bradford, and Representative Saylor, who is not here, but all of these folks have had a lot to do with, I think, why we're standing here today. And it's an important announcement. I'm proud to be here with this bipartisan group. Yes, I know there are a lot of things we don't agree on, but when we agree, we can actually work together. And this is to mark a major investment in the COVID-19 response for Pennsylvania. As you all know, we have been fighting as a Commonwealth COVID, the pandemic, for nearly 2 full years now. And our healthcare workers who are on the front lines have borne the brunt of this fight. They're the ones fighting day in and day out to treat the sick. They're the ones who are comforting the bereaved. They're the ones who are trying to keep all of us safe. And each successive wave of COVID has made its way through our Commonwealth. They have been on the front lines. They have given everything they have to keep our hospitals, to keep our healthcare facilities, to keep our staffs from being overwhelmed. They are, and they have been for 2 years, under extreme stress. And in recent weeks, this has only gotten worse. As the Omicron variant has surged, although now we're on the downturn. Actually, we're not counting, we're not getting complacent, but things are looking good. But our healthcare workers deserve far more than just our gratitude and a pat on the back. They deserve all the help we can give them. So my administration has taken numerous steps to mitigate the unprecedented stress on our healthcare system. Like back in December, additional support announced from the Federal Emergency Management Agency, FEMA. And they heeded our call, and they asked for strike teams, federal strike teams, to come to Pennsylvania and help, and they did. We have 2, one in York, one in Scranton. We have also set up our own strike teams here in Pennsylvania. We are doing testing. We have a number of sites set up in different counties throughout Pennsylvania. That keeps growing. State sites, we're also working with the feds. We have 2 sites that we have worked with them to get directly in Pennsylvania. Philadelphia County has its own federal site, so there are 3 in Pennsylvania federal sites, the ICAT sites. The state is also working with a group called Ginkgo, Cuventa Ginkgo, to make sure that schools, any school that wants to have a testing site can have one for free. We're doing all those things. The Pennsylvania Department of Health and the Pennsylvania Emergency Management Agency, TEMA, are also launching regional support and strike teams, as I mentioned, for hospitals over and above what the federal government is doing. And these strike teams, again, are in addition to what the feds are doing. We are launching help with long-term care facilities. We've been doing that, but again, healthcare is a continuum. Hospitals need places for people they discharge to go to, and so we need to work with the long-term care facilities, and we're helping them. We have the Long-Term Care Resiliency Infrastructure Supports and Empowerment Program. The acronym is RISE, of course. So that's a program to help provide resources for consultation and expertise to these facilities to battle the COVID-19 stresses. These are all important steps to increase resources for Pennsylvanians and provide critical support for our healthcare workers. But hospitals have also asked for funds to support the recruitment and retention of key personnel. They need help to make sure they have the workforce we need them to have to address this issue, including nurses, respiratory therapists, and support staff, direct care support staff. So 3 weeks ago, we all worked together. We convened a working group, including all 4 caucuses of the General Assembly, to take action to provide relief to our hospitals and healthcare workers. House Bill 253 is the result of these conversations, and I am proud of what we have accomplished in just a few weeks. It's proof of what democracy can achieve when we work together to make a difference in the lives of Pennsylvania. House Bill 253 is a $225 million investment in supporting our healthcare workers and relieving stress on hospitals. And I'm going to be proud to sign that in just a few minutes. I want to thank all the legislators who are standing here for the hard work that you have all put in the bill. You really worked fast, and we got this done in a really timely fashion so that we can actually help get this money out to the folks quickly. You got it to my desk quickly, I'll sign it quickly, and this is going to turn this around. This bill uses federal American Rescue Plan Act dollars to address workforce shortages by providing $210 million in support for recruitment and retention of key healthcare workers. This support is available not only to hospitals, but also to behavioral health centers. By ensuring that specialized facilities across Pennsylvania have the capacity to treat patients, we can better support Pennsylvania's entire treatment system, and we can reduce crowding in hospitals. The bill also increases our Commonwealth's investment in the PA Student Loan Relief for Nurses program. Thank you, Senator Collette. With an additional $15 million. FIA has $5 million in that program now. This adds an additional $15 million. The Student Loan Relief for Nurses program was created to help support nurses who have been on the front lines of fighting COVID to pay off their student loan debt. The program launched on January 1st and has already received more than 8,000 applications. This additional investment will give us the resources to help more of our heroic nurses shed the burden of debt. This is a major direct investment in supporting the healthcare workers who have done so much for our Commonwealth over the past 2 years. So I want to thank all of the healthcare workers who have given so much to serve our Commonwealth throughout this pandemic. All of us standing here recognize the overwhelming burden that has been placed on your shoulders. And while we are deeply, deeply grateful, we know that what you need is not our thanks. What you need is our help. So starting today, help is on the way. Thank you. And now I'm going to turn this over to Minority Leader Senator Jay Costa.
Thank you. Thank you. Thank you very much, Governor. If it's okay, I'm going to remove my mask. But Governor, thank you for the opportunity to say a few words about this comprehensive approach to addressing our healthcare crisis that we have here in Pennsylvania and how we deal with the COVID-19 and our response. As was mentioned, the Governor talked about a number of programs that will be implemented, particularly in the short term, to work with our healthcare providers and our workers, which I think is extremely critical at this moment in time, especially as we know. More importantly, I think the legislation that the Governor talked about, I think, is a demonstration to those individuals, those workers that he talked about, who we do owe a debt of gratitude to for over the course of the past couple of years, the work that they've done, how significant that has been and will continue to need to be. Putting out $225 million first to hospitals with $100 million, $110 million into the high Medicaid hospitals, as well as the community hospitals and high critical care hospitals and the like, and behavioral specialists and programs, is hugely important. And it's going to be able to help stem the tide with respect to what hospital settings and the like are dealing with respect to retaining individual employees and recruiting those folks going forward. That's the struggle, that's the key, and that's what these resources are going to do. But more importantly, the language, as I understand it, have been crafted in a way that really directs the resources to get to the bedside, to get to the folks who we're trying to help and trying to work with and trying to maintain in that employment. That's what those resources are designed to do, and there are measures that allow them to make sure that occurs as we go forward. And certainly, just want to let the hospitals know that we're watching, and we'll keep an eye on it to make sure that that's where those resources go. That all being said, I also have to say that in terms of sustainability with respect to the healthcare workers, the loan forgiveness program that our colleague, Senator Maria Collette, designed and brought to us a number of months ago is really going to be beneficial as well. It's going to be something that's going to maintain folks for a course of years. Keeping nurses and relieving them of that debt is going to allow them also to continue to work in a longer period of time to be able to not have to worry about that debt along those lines. So I'm grateful for the recommendations and ideas that came from my colleagues, both her and Senator Hughes, and certainly working together with my friends and colleagues on the other side of the aisle was a comprehensive approach, a bipartisan approach. And as the Governor indicated, it demonstrates that what we can do when we work together and put our heads together when there's something that needs to be addressed. So I'm very pleased to be here. I'm very glad that we've gotten through this process and look forward to more of these conversations as we go forward. So now, without much further ado, my good friend from the leader of the Senate Republican, Senator Kim Ward.
Thank you. Okay, this thing doesn't go down, so this is an example of a talking head. I have a new picture of what a talking head looks like. Thank you so much, and thank you, Governor, for putting this together. Thank you, Jay. When I look at what happened here in just quickly, right, in the last week and a half, 2 weeks, it goes to show that it doesn't matter what our parties or our disagreements are. We can do that, and we do forever. But when it comes down to getting something done that needs to be done for the citizens of this Commonwealth, we come together. You know, we're a big family, and I'd love to see more of this. It's good. This at the very end of the day, this bill is about our acute care workers. They have lived through so much these past 2 years. As we saw 40,000 Pennsylvanians die, they were holding their hands because their families couldn't hold their hands. They deserve everything that we can do to help them. It was a war zone out there. They put themselves at risk, they put their families at risk, and this bill just says, we have your back, we appreciate you, and we are so grateful for you. And I don't have a lot more to say. I'm happy that we're helping our hospitals and that being able, therefore, to help the people that really keep us healthy and keep us going. Could you just imagine for a minute if you were sick and you went into a hospital and you had nobody to care for you? Because these hospitals have been full. They have been stretched as far as they can go. At one point, UPMC put a tent up outside. My husband's a physician, and he had a lady that came in about a month ago, and she sat in an ER for 5 days because she needed to be admitted, and there was no way to do it. So this is a great bill and a great example of what we can do when we're all together. Thank you.
Leader McClinton's next.
Sorry, she's taller than me. You'll be able to see her. So it is a great honor and pleasure to introduce my friend, Leader Joanna McClinton. Look at her. Look at that.
Leader Ward, I had a little help today. I'm regretting those extra inches the longer we stand. So I'll be right to the point. You know, quite seriously, when the governor called me earlier this year saying, you know, the time is long enough that we haven't done what we need to do for people who have risked their lives, for our livelihood, for us to be able to battle this pandemic, to get through it together. And here we are in year 3, still in a global pandemic, but we here in Harrisburg had not previously done what we needed to do to be responsive to these healthcare workers. From my good friend and colleague, Representative Bridget Kozarowski, the only healthcare professional in our 203-member body, to Senator Collette on the other side of the building. We know what it takes and what our nurses, what our doctors, what our medical assistants, what our CNAs have been dealing with, and now for us to be able to stand together in a bipartisan, bicameral fashion and say $225 million has been delivered. We've not ignored the tears, the long hours, the patient being there for long amounts of times, and sadly, so many of those patients not ever making it back home to their families. We're responsive, and I just look forward to this being a new page here in Harrisburg in 2022, that we continue to make sure that we reinvest with President Biden and Vice President Kamala Harris worked so hard in Washington, D.C. to deliver. So thank you, and with that, back to Governor Wolf for questions and answers.
All right. So, be happy to take questions on topic, and if there are any questions off topic, I'll do a gaggle after that. I'd really like to revel in the moment of bipartisan amity and unity here. Yes?
On topic, just, this is bipartisanship right now, but we just had months and months of partisan gridlock. We're heading to a really big election year. What promises do you have to Pennsylvanians that this is just a blip because there's some federal money?
Well, I think ask any of us here, we'll be very open and forthright about the idea that we disagree on things. I think I've vetoed probably more bills than any governor since. Yeah, okay. So. But look at what we've gotten done. We've put almost $2 billion into education over the last 7 years. We have, because of bipartisan work, we have the largest rainy day fund, I think, in our history. We have a budget surplus last year of $3 billion. When's the last time Pennsylvania had that? We're going to have one this year. Again, we have done things with criminal justice reform. We've worked together across the aisle to figure out how to do some pension reform. We've done liquor modernization. You can now buy beer and wine where you buy your groceries. That's something that's brand new and hasn't been in place for a long, long time. We have 11,000 fewer people in our state correctional institutions. We've done a lot of things working together. So I think you can look at the last 7 years and say, okay, we've had a Republican majority General Assembly and we've had a Democratic governor. And in a lot of places, that's a recipe for gridlock. In Pennsylvania, we have been completely honest and forthright about our disagreements, but we have also figured out where we can work together, and we have gotten a lot of good things done. So I would push back against that. I don't know if anybody else wants to.
I do.
Sure.
Stop being a donor. We're celebrating.
Good job, Ken. Good job.
What she said, yeah.
Say that again.
Yeah, here.
Good job.
Yes, Jan.
As we do anything to direct money to, I thought I saw something about EMS providers.
Yeah, the speaker it was especially helpful in that. Now, he is not here yet, but I think that's something that we all support.
So he was the one pushing that.
We all think it's important. He just wanted to make sure that we don't forget the EMS workers. So that's this is $225 million, and I'm sure that he'll have some more to say about that. Yes.
Governor, we'll see you. In some conversations I've had with nurses recently, they've said some of the things leading to them dropping out of the industry or getting exhausted is patient staff ratios that are not high enough and not low enough, requiring them to suffer what they call moral injury. They're seeing people die who they know that in a better scenario could have been home. I'm hoping that you or someone here can give a little bit more of a level of detail to help understand how this money, which I certainly understand hospitals need, will help those nurses with either that problem or some of the other
Yeah,
problems.
I think as Senator Costa said, this money comes with strings attached. There will be oversight and there'll be accountability. Now, when you get to some of the things, the staffing ratios and things like that, I think we have that's an area where we still have to make some policy decisions here. I mean, you won't have any lack of people on one side or the other of that particular issue. I think what we're all saying here is, regardless of some of these specific details, we need to do real help, provide real help to our frontline healthcare workers. $225 million is not a bad start.
Absolutely. Just a quick follow-up. Is there the opportunity then for direct payment, retention bonuses to healthcare workers? Is that what the
Yeah, that could be part of it. It's up to each of the healthcare institutions to decide how they do this, but we're going to be looking over their shoulder.
Governor, does your administration
Yeah.
have any sort of estimates on the number of eligible healthcare workers who might see a bump in pay or retention bonus under this?
I don't have, I know Secretary of Health, do you have any numbers? How about if we follow up and get those for you?
And with respect to the loan fund for
Right.
nurses,
Mhm.
you just mentioned that the program has gotten more than 8,000 applications.
Right.
Will this $15 million ensure that every application is met?
I'll turn that over to Senator Collette. Probably not. There's $5 million in the program now. They've had 8,000 applicants for that $5 million. You can do the math and divide if all 8,000 qualified, and I'm not sure that they do for support. But I think the program would be for up to $7,500 per year of forgiveness, and even a quadrupling of this to 20 million, from 5 million to 20 million is still probably not going to be enough to do everything. But at this point, we really don't know. I don't know, unless you know, how many of those 8,000 actually qualify and actually what the dollar amount is and how far that 20 million is going to go. But I think there's broad support for continuing to do this. Senator, you want to say anything?
I just wanted to add that it's $7,500 over a 3-year period, $2,500 each year that the nurse qualifies and stays employed in a qualified facility. And so at the level of applicants that we have now, this money is going to go a huge way toward meeting more applications than that initial $5 million that we invested the first time around. But, as the governor said, we need more funds. We want to make sure that this is a robust program and that the applicants that are qualified are able to, get that reimbursement. It's a great way for us to retain nurses, and it's a great way for us to make sure that Pennsylvania is a really attractive place for nurses to want to work and stay.
Mr. Governor, as one follow-up, how did you arrive at the $210 million for healthcare workers? I mean,
It's actually, we wanted a big number. We've been working with hospitals, and we think it's in the range that we really ought to be doing this. We wanted to make sure we included behavioral health. We wanted to make sure this went to the frontline workers. And in talking to the healthcare professionals, this is what they said they needed. We also want.
they ask for what? Did the hospital system ask for what?
Sure. But I think we all agree that this is a substantial amount, and that this is certainly a good infusion into the healthcare system. So I mean, who wouldn't be asking for more if you can get more? But this is real money, $225 million plus what I think we end up doing for the EMS. It'll probably be closer to $250 million. So it's a lot of money. Yes.
To Brett's point earlier about nurses who said they just way too stressed out, that's why they're leaving. A lot of nurses that I've heard from have said these problems have been going on way before the pandemic. I'm wondering if you can address some of the concerns about safe staffing standards that they've been pushing for. There's still debate over whether that's going to get.
Yeah, I think the Department of Health has already done some work on staffing ratios, and will continue to do that. And I think you would find the morale of the frontline workers probably varies from healthcare system to healthcare system. Some are doing a better job than others. I think right now, everywhere, we're seeing the great resignation. We're seeing a lot of people being a lot pickier about the kind of jobs that they're willing to take, careers, the job, work sites, workplaces. And the healthcare professionals certainly are not immune from that general trend. And then on top of that, they're the ones that have been on the front lines during this 2 years of really exhausting work. So I think there are a lot of reasons and things that we could look at to say we can make this workplace better. We can do a lot here in the Commonwealth to make our workplace better. And I think that's something that we're certainly looking at as the Department of Health. Secretary, you want to say anything here on this? And I don't think anybody at this point has a last word on that.
Sure. Thank you, Governor. So I would say that overall, the Department of Health, in collaboration with PEMA and the governor's office, has done a tremendous amount to support our frontline healthcare workers, particularly in the last several weeks. I agree with you entirely. Morale has been probably at an all-time low for our healthcare workers, which is part of why we've deployed 3 different lines of efforts to provide assistance to help decompress hospitals by deploying short-term staffing, by setting up regional decompression sites, and by expanding capacity in our skilled nursing facilities. What we've heard already from the sites where we have deployed these staff, in particular for our short-term staffing missions, is that is a huge boost to morale. But it is a short-term fix. And so programs such as this are essential pieces of legislation to improving the overall healthcare workforce and healthcare environment over the course of the next several years. With regard to staffing ratios, that's certainly something that in the long-term care space, the department has been a real advocate for increasing staffing ratios, and in the hospital space, as the governor said, we're still considering our policy options. Thank you, sir.
Yes.
Do you have an estimate on how long it will be until this funding is released for the institution?
We're trying to get it as quickly as possible. Anybody have a sense of how fast we can actually start? 30 days. Huh? 30 days. Okay, thanks a lot.